I often compare the carpal tunnel, which is an area in the wrist, and it's on the front side of the wrist rather than the back side of the wrist. We term that the volar or the palmar side of your wrist. And on the palmar side of the wrist, you have a tunnel. And that tunnel I liken to a plug. And everybody's hopefully opened up a plug or has seen somebody open up a plug. And if you open up the back bracket of the plug, you'll see some wires entering, and you'll have an earth wire, you'll have a red wire, and you'll have a blue wire. And they enter into the plug. And on top of that, you have a little rubber bracket that can compress on those wires. And if it compresses too heavily, those wires get cut off. And as a consequence, the plug doesn't work anymore. So the electricity doesn't actually run through. So my analogy to the carpal tunnel is that you have a specific nerve that runs in the carpal tunnel, which we call the median nerve because it's in the middle of the wrist. And it gets compressed by the bracket. We don't call it the bracket, we call it the carpal ligament because it's in the carpus. And that pushes down on that median nerve, and it causes the wires to, particularly the thumb, the index and the middle finger, to fire intermittently or not fire at all. So what do you feel as a patient? You don't feel your fingers anymore because the wire has been compressed too much. Or you'll feel pins and needles because it's just like a light bulb. It will flicker sometimes and flicker not so often. And the consequences are quite a nuisance because you wake up at night with those symptoms of pins and needles. And then you have to shake your hand, which is a classic symptom in carpal tunnel syndrome because you're trying to send the signals down the wires. And I always find that my patients understand what carpal tunnel is with this analogy to the plug. In order to allow that nerve or that wire to fire off properly, you need space. So you have to somehow reduce the swelling on that nerve. And how can we do that? There are various ways. You can either splint the wrist, and in doing so, you prevent that wire from being compressed, in particular during the night hours. Because we always have various positions while we're sleeping. Some sleep like this, some sleep like this, and that causes some compression on the nerve, which is already tight. So to avoid that, a splint at night can do the trick because it just keeps that wire in the right place. Another option is to inject some steroid around that nerve. And in doing so, you reduce the swelling and therefore create more space for that wire and that nerve to fire off. And if those attempts fail, then you're going to need me to open up the bracket, incise the carpal ligament as we call it, to create some room for that nerve to flow and send off its signals. Although the majority of carpal tunnel syndrome patients, there is no known cause, there are some patients who have risk factors for developing carpal tunnel syndrome, such as diabetics, renal patients, rheumatoid arthritic patients, and a subcategory, the pregnant population who have a higher risk of developing similar symptoms. There have been some papers published, and there's been quite a lot of research trying to link road drilling or repetitive type of activity at work with the development of carpal tunnel-like syndrome or symptoms. And although it may cause some symptoms during that period of activity, it's not a direct cause. And in a lot of the papers that have been published, we haven't found any direct link. There are, however, some positions that you may be sitting in a long for a long period of time that can cause a similar kind of symptom. And I liken that to those people who are driving and they get behind their wheel, or if they're reading the paper or on their mobile phone, it will suddenly cause carpal-like symptoms, carpal tunnel-like symptoms. And the reason for that is, once again, they're holding their wrist in a certain position for a longer period of time that causes carpal tunnel syndrome. And so there are patients who are unaware of the fact that they may be sitting behind a desk or behind the wheel of the car on their mobile for a long period of time, and that causes a compression of their median nerve, and they get the tingling and the pins and needles in their fingers.